The Provincial Command Council has given an update on the COVID-19 pandemic in Gauteng. Premier David Makhura says his office has been hard at work to prepare for the months ahead. He says the Easter weekend is worrying and the winter season brings its own challenges. Govan Whittle's following the story for us. He joins us now live. So what's the status of the vaccination program first?
There's over 100,000 healthcare workers in Gauteng that still need to be vaccinated. They've vaccinated about 40,000 of them now. There's about 175,000 of them in the province. So they're making slow progress, but it is progress, Shahan. And at the moment, the health department's provincial officials, as well as the Premier, seem a bit frustrated by the pace at which they're receiving the vaccines. Essentially, they say that they can administer them faster than they're getting them. And at the moment, they're hoping that they'll get one big drop-off of vaccines up to 500,000 or 600,000, and they say if they do that, then they can start to achieve some of their targets in their plans for the vaccination rollout. So they're hoping to vaccinate all 750,000 healthcare workers in Gauteng before they start vaccinating the elderly and people with comorbidities, essentially those that are at greatest risk among those that are at risk. And that's phase 2 of the plan, and they're eager to get this done before winter time. But at the moment, Shahan, it just doesn't look like this is going to happen. They've accepted that the third wave is inevitable, and they're starting to brace for it. But let's have a look at what the acting CFO of the Department of Health in Gauteng had to say about the number of healthcare workers that need to be vaccinated.
The side effects that we have experienced across all the vaccinating sites are 97 as at yesterday. In the main, 96 actually of those side effects were just minor things where a person would complain about just the arm being sore where they were vaccinated, or a little bit of swelling, a mild headache, and some people say they are feeling dizzy. But because we do have an area for observing them after vaccination, they stay there after 15 minutes, they are okay, and they go home. We did only have one adverse event. It's still under investigation. We still have to hear what happened. And as indicated in the last briefing, the Medical Research Council is the one that deals with the adverse events. We report to them and they follow up the patients and do their full workup on the patients.
So, of course, the Easter break is coming up, and that presents a risk of another spike in infections. What's the provincial government's plan?
Well, they're hoping that the residents of the province who will be travelling out and coming back will protect themselves. That's the plan in a nutshell. They're not going to lobby for any additional restrictions to be placed with regards to travelling over the Easter holiday. And they believe that last year, when they had to ask people to stay in Gauteng for the Easter break, that it was a lot to ask. And this year, they don't want to put that pressure on the general populace. Instead, they believe that Gauteng's residents can take the necessary measures to protect themselves. Let's have a look at what the Premier had to say.
There are important things that are worrying us. We are moving towards Easter. The Easter weekend is a weekend where large number of people move out of our province, so the level and extent of mobility, increased mobility, is always an important risk factor with regard to the spread or the potential spread of COVID-19. The infection rate, its relationship with increased interaction amongst people and mobility. So we are getting to the Easter weekend. So the Command Council has been looking at what that might mean, but we are also moving to winter. So there's two at the backdrop of this is the Easter weekend, and we are moving to winter. And again, during winter, we ordinarily worry about the flu season. And our teams, our health teams, have also been reviewing what they normally do during winter. They do immunization, flu immunization during winter. They looked at what we did in 2020. There are also other immunization programs. But we also extensively looked at the real vaccine rollout, the extent to which our province is ready,